we have a crisis because 40% of learners between the ages of 13 and 15 are smoking. And all those C's that Dr. Naledi pointed out, your cancers, your cardiovascular issues, and COPDs, and all those things, they are now starting to set into the children in a very, very very early stage. And can you imagine, like Dr. Naledi said, 8 years old, right?
As young as 8.
As young as 8 years old. And that actually agrees with what the study says. Some started even as early as the age of 7. And what the tobacco industry does, another study was undertaken. This is the Big Tobacco Tiny Targets survey. And this showed that the tobacco companies, those that sell the cigarettes, are targeting children. They're targeting learners in the schools.
It's a wonderful good afternoon. Welcome to Tele Doctor Show. We're back yet again for another exciting show. And hosting today's show, I'm Dr. Blessings, and today we have a very exciting show. But before we get into it, allow me to just introduce you to my very special guest who has joined us today. And this is no other than Dr. Naledi Chunga. Good afternoon, Dr. Naledi.
Good afternoon, Dr. Blessings.
Thank you so much for joining us. We're extremely excited to have you on the show today.
I'm glad to be here.
Indeed. And we also have another guest who is Mr. Albert Piri. He'll be joining us very shortly. And today we're discussing tobacco, the loudest killer in plain sight. So as you all know, every year, May 31st is World No Tobacco Day. It's a day when we get to celebrate, firstly, tobacco control champions, and also to educate the public on some of the harmful effects of tobacco use. As you know, tobacco use has actually been on the rise. We've got so many young people smoking, so many other women as well who are using tobacco for different reasons, and we'll be able to get that into our conversation. So this is a topic that we must have, and also reminding you that this is a call-in interview. You can call the number that will be displayed on your screen for any questions or any contributions towards the show. Also reminding you that the Tele Doctor application is very much available for download for those using iPhones on your iOS store, for those using Android phones in the Google Play Store, and you'll definitely be able to access a variety of services there. If you want to speak to a specialist, if you want to make a consultation, you want to just generally ask about your health and well-being, that is the application for you, definitely. Also reminding you that this very show is very much live on our Diamond TV Facebook page, as well as the Tele Doctor Zambia Facebook page. So you can also follow us on Facebook as well on these two platforms. We've just been joined by our second guest, who is no other than Mr. Albert Piri. Welcome, Mr. Piri.
Thank you, Dr. Blessings. It's great to be here.
Definitely. We're looking forward to having this interesting conversation with you. So according to the World Health Organization, every year, about 8 million people die as a result of tobacco-related deaths. And so this number has actually been increasing over the years. So before we get into the conversation, allow me to just bring in my guests. Let me start with you, Dr. Naledi. Just tell us a bit about yourself before we even get into the conversation. Who's Dr. Naledi?
So Dr. Naledi is a medical doctor. I currently work at the Center for Infectious Disease Research right now. We are a project focused on the prevention of non-communicable diseases and monitoring for people living with HIV. I'm a 2023 Mandela Washington Fellow. I'm also a co-founder of a mental health nonprofit and an advocate for holistic medical care, which looks at the habits, which is why I think talking about tobacco and the kinds of lifestyle we have is important here in Zambia.
All right, thank you so much, Dr. Naledi, and we're extremely excited to actually have you on the show for the first time. And of course, Mr. Piri, thank you so much for joining us. Just tell us a bit more about yourself as well. Who is Mr. Piri? What does he do? Even away from the seriousness.
Right. Thank you, Dr. Blessings. Well, as you have said, my name is Albert Piri. I wear quite a number of hats. I have been in the media. I have worked in the media, both as a presenter, producer for a number of media houses. I eventually ended up with a stint at the Ministry of Health as a communication specialist there. I have a big interest in matters of public health, and I think that's what gravitated me towards being a public health activist, specifically in terms of tobacco control, advocate. I am also, a lay preacher. And at the same time, I have also dabbled into the arts. I have a small little outfit, little company that deals with the arts, the script writing and things like that. Then it's good to be amongst two doctors. Because I also play the role of a doctor as well in one of the soap operas.
Okay,
it's great to be
I think I've watched you on TV.
Two real doctors.
I'm just trying to remember where I watched you, but I know that you are a very big actor.
Thank you.
I just didn't know the lay preacher part, so I'm just finding about it on TV. All right. Thank you so much, Mr. Piri, and thank you so much for joining us. So then as we begin, let me start with you, Dr. Naledi. Why are we talking about tobacco in the first place, and as well, why is tobacco harmful? I know that we talk about asking people to smoke and all these things, but why is tobacco harmful? Why should we talk about tobacco?
So I think we talk about tobacco a lot because it is one of the biggest risk factors for people who develop non-communicable diseases. When people use tobacco, I know the Zambia National Public Health Institute released a list of 15 ways in which people use tobacco, and I found that list very shocking because it was given in terms of age groups, and we found people as young as 8 were using tobacco. And I thought, aside from it being very shocking, we are introducing very young people to things that are harmful to their health, and we are introducing it to people who are unable to make sound decisions around their tobacco use, with the long-term effects being something they have to live with.
Yeah.
So tobacco is harmful firstly because it's addictive. It makes you dependent. It's something that feels good when you use it, but over time you're unable to do without it. And I think a lot of the issues that we are concerned about when we're looking at our health burden in young people is related to the use of tobacco. And the funny thing about tobacco is you don't even have to be a person who smokes or takes shisha or chews tobacco to be affected. You just have to have one person in the household who smokes, and we are all suddenly experiencing things we have not consented to and things that are very expensive to treat. So I think that's in a nutshell why we talk about tobacco, because it has a very long-lasting effect on our lives, and also because a lot of people use it without knowing the effects of it. Yeah,
so Dr. Nelly has talked about a very important component, the aspect of secondhand smoking. So before we get into that, what are some of the different types of tobacco products that our viewers should know about? Because I know that we all know that the cigarette, of course, is tobacco, but what are the different other products that are available, and what would your comment be as well on secondhand smoking, for example?
Exactly, and I think Dr. Naledi really has laid the foundation, and also I think to emphasize that the tobacco industry, the industry that makes these products, thrives on addiction. And so we have a number of emerging products that are coming through. For instance, shisha, that a lot of young ladies like to partake of. We also have there are also e-cigarettes, and these come in all kinds of forms and shapes and sizes. Some look like it's a little USB. Some look like a pen, and that is why it is so deceptive. Because tobacco is very, very harmful. Nicotine is very, very addictive. So in line with this year's theme of the World No Tobacco Day, unmasking the appeal, I think it's very, very important to identify and to call out the dangers of these new emerging products. I must also hasten to add that among these products that's really quite very, very harmful to health is vaping. Vaping now has become so vogue, so happening. If somebody's vaping, it's trending. But it is very, very dangerous. I think, like somebody said, it's akin, it's similar to somebody taking mazoe or any orange juice or any nice juice and mixing it with a poison. But it's still poison, It may have that flavor. And that's what makes it so insidious, so dangerous, having these products that are full of nicotine and packaging them with an appeal. That's what makes them so dangerous.
Indeed. So, Dr. Naledi, as a medical doctor in your practice, what are some of the diseases, the common diseases that people should know about that, for example, are caused by tobacco? Because as I think earlier I said that about 8 million people die due to tobacco-related deaths globally. So that's a very huge number. And I think in Zambia we're talking about over 7,000 people who die every year as a result of tobacco-related illnesses, which is approximately 20 people dying every day due to tobacco-related issues. So what are some of the common diseases in your practice that you have seen that are caused by tobacco use?
So I'm a big fan of lists, so I like to list things. I think tobacco can be broken down into 3 big C's. The number 1 C being a cancer. All forms of cancer can be related to something to do with tobacco. Whenever you use tobacco, no matter the form, if you're chewing, if it's snuff, if you're smoking, vaping, I think cancer is something you should worry about in your future. The second C is cardiovascular. Cardiovascular is things like heart disease. A person can have things like a high BP related to the smoking. Nicotine itself is a very powerful stimulant, and it works with your mind, right? And the chemicals that work in your mind work on the reward system. So whenever you smoke the nicotine, you feel good, you're able to cope, you're able to do a lot of things that ordinarily you feel you might not be able to do. And I think that dependency then feeds into things like the 2 C's above. And the last C that I would say is COPD. COPD is chronic obstructive pulmonary disease, which is an illness of the lungs. A lot of the time they are a group of diseases, and I think the majority of them are things like emphysema, chronic bronchitis, which we now call smoker's cough, which is very common if you know somebody who smokes, and emphysema, which is just collection of pockets of air in the lungs that make it less functional. So I think those 3 are the most dangerous that we have seen in our practice, although there are other things like a weakened immune system. You are more susceptible to have diseases if you smoke. You are also somebody who is likely to develop things like type 2 diabetes if you're a person who smokes. So if you think about it, just that simple act of using tobacco on a regular basis is a danger in so many different ways, and I think it's something a lot of people need to know about.
So virtually it affects every part of the body.
In every way.
Yeah, that's the reading recently that even infertility.
Yes,
So
and I
people,
think infertility, because it doesn't kill, not many people are talking about it, but I think it's something a lot of people stress about. It does cause infertility, especially in younger couples. Failure to conceive is something we have seen in our practice.
So for those who are addicted, for example, how do they know that I'm actually now addicted and I need to seek help?
So I think especially in the early days, it's easy to tell. One, you have an increased frequency in the number of times you want to smoke. You smoke from going from maybe 1 cigarette a day, and which I mentioned, it works on the reward system. A lot of the time, if you're a person who uses nicotine, that 1 cigarette doesn't do it anymore. You start to smoke 2, you start to smoke 3, before you know it, it's a pack a day. And the escalating need to smoke is something you should always look out for if you're a tobacco user. The second thing I would say is irritability. You tend to be very short with people. You are easily annoyed. You're not able to do what you do with the same amount of patience. And then it's also feelings of anxiety when you do not smoke. I think that is something that you feel you can't do without it anymore. It's now a part of your day-to-day life. And also the inability to concentrate, difficulty sleeping as well. I think those are things we have seen and received as complaints when people are actually developing a dependency for tobacco use.
All right, interesting. So, Mr. Perry, having talked about the health background itself and some of the harmful effects that tobacco has on health, what could be some of the other effects as well that we can think about, let's say on an economic level? And then also the follow-up question would then be, I believe there should be laws for everything. Are there any existing laws, for example, that seek to regulate tobacco use here in Zambia?
Right. Actually, the effects on the person, as Dr. Naledi has very ably described, are very telling. But there's also a great effect on the community as well as in the nation. A study was done in 2019, I believe, and it showed that Zambia spends over 2.8 billion kwacha in treating tobacco-related illnesses, ailments that are directly attributable to tobacco, and even the spike and the rise in NCDs can be attributed as well to tobacco. I think it's about, was it about 2 or 3 months ago, when the registrar at the at UTH released a statement saying that there had been an increase in cases of throat cancer, and many of those cases were directly attributable to shisha and other forms of smoking. So it has that effect. It has a terrible economic effect. But then again, there's the argument that tobacco contributes a lot to the economy. But the reality is that same study that was done, the investment case for the case for investing in Zambia's domestication of the WHO FCTC showed that the cost of tobacco on the economy, in terms of not only illnesses, but lost productivity, absenteeism, and all those things, was about 1.2% of the country's GDP. And yet, tobacco's contribution to the economy was less than 0.5%. Not even 1%, but less than 0.5%. So on one hand, the cost of treating tobacco-related illnesses is 1.2% of GDP, and on the other hand, its contribution to the economy is less than 1%, even less than 0.5%. So what that does is that it creates a sick population. And as you will know, wealth is a function of health. You cannot generate wealth when you are unhealthy. So in broader terms, and in terms of the longer term and so on, it has a very devastating effect on the economy and on the nation. And also, if I might add, we're talking about regulation. We really need, and that is why as the Tobacco Control Consortium of Zambia, of which I'm privileged to chair, we have been, among other stakeholders in the tobacco control space, calling upon government to expedite the enactment of the Tobacco Control Bill. Other countries where these big tobacco companies come from, the consumption of tobacco is going down. Why? Because of very strict regulation and very robust tobacco control and public health laws. But these companies, the big tobacco companies, are going into areas, and they have targeted Africa, because Africa generally, especially Sub-Sahara, has very, very weak regulations in terms of tobacco control policy. And what that is doing is that the younger generation, who are now taking up the vapes, the shisha, and the cigarettes, the future is quite bleak. Let me just pause for a while, if you may allow me. I have with me here, this is a survey. It's called the 2021 Global Youth Tobacco Survey, the GYTS. This is a survey that was done, a study that was done amongst learners between the ages of 13 and 15, just to look at the consumption of tobacco and so on. And the findings are quite damning. We have a crisis because 40% of learners between the ages of 13 and 15 are smoking. And all those C's that Dr. Naledi pointed out, your cancers, your cardiovascular issues, and COPDs, and all those things, they are now starting to set into the children in a very, very early stage. Yeah, very, very early stage. And can you imagine, like Dr. Naledi said, 8 years old, right?
As young as 8.
As young as 8 years old. And that actually agrees with what the study says. Some started even as early as the age of 7. And what the tobacco industry does, another study was undertaken. This is the Big Tobacco Tiny Targets survey. And this showed that the tobacco companies, those that sell the cigarettes, are targeting children. They're targeting learners in the schools. Within a 100-meter radius. This study was done here in Lusaka, but I think it is something that is fairly representative of what's happening along the line of rail and countrywide. The big tobacco companies are placing their kiosks, they're placing their selling points within a 100-meter radius of schools. Go around Lusaka, and chances you will find 99% of those schools have tobacco being sold within a 100-meter radius. It is a very deliberate ploy by the tobacco industry to get the customers early. When you have a child addicted, when you get them ages 13, 14, 15, they become a customer for life. And that is the tragedy that we have as a nation. And that is why we urgently need the Tobacco Control Bill to be enacted by Parliament. 2008, Zambia ratified the WHO FCTC. This is a convention that said that, where Zambia agreed to have tobacco control legislation in the country. In 2003, thereabouts, early 2000s, the nations of the world got together and recognized that tobacco was an epidemic. And so they got together and came up with this treaty, the WHO FCTC, to have healthy nations, healthy populations, and public health has precedence over any profit, any private profit. Public health is number one. But Zambia, since 2008, has been stalling. But thank God for the new administration. When they came into government, they made an undertaking that they would enact the tobacco control bill, and progress has been made. And we are just urging government to take it further. And have this legislation to protect the future of Zambia, to protect our children. It is very, very important.
Sure.
Indeed, I think that's well put, Mr. Piri. I think I love the fact that you've given us very wonderful statistics, particularly affecting mostly young people. And recently, I think the World Health Organization also said that by 2025, which is this year, there'll be 300,000 new smokers, of which most of those are actually going to be young people. So coming to you then, Dr. Naledi, how easy is it, for example, to treat these diseases, hypertension, cancer? How costly is it, for example, not only for the individuals themselves, but even for the government? Just how difficult is it to treat these diseases?
I think just looking at hypertension itself as just one disease, it is a very expensive illness to have. And if you have that paired with something else like a diabetes or a cancer, that almost quadruples the health bill in your home. So I think it's very difficult to treat, firstly. Secondly, it's very expensive to treat because, one, you have to take medications chronically. And aside from that, it reduces the quality of life. If you have to take a pill every day, every pill you add reduces, one, your quality of life, and two, your ability to keep up with it. So you find that a lot of our clients or patients who smoke, who use tobacco regularly, tend to have worsening symptoms and worse outcomes in terms of them going towards things like stroke and things like heart attack. And once you get to that point, one, it's no longer something we can treat as preventively. We're asking you to stop smoking as a preventive measure for these bad things, right? But when you get to a point where you're in hospital because of your tobacco use, it's more expensive immediately. You are going to a higher level of care. You are no longer seeing a clinician at your first level hospital. You're coming to a specialist at a tertiary or a quaternary hospital. You are also going into your pockets now to treat something that you didn't have before that you could have done without. I think just thinking of 2.7 billion as a number is a huge amount of money. We can use that to educate our children. We can use that to make our health practices more robust. I think there are things we've had, like a cholera outbreak. If we had 2.7 million, I think we could have prevented a lot of the bad things that happened during that time. So I think it's difficult to treat, but not only is it difficult to treat, it is very expensive to keep up with, and it's very costly in terms of being productive as a society, in terms of how healthy we are. So there are several things that play into it, but I will say it is a challenge to look after somebody who has the diseases that come with the tobacco use.
I don't know. I don't know if I can just chip in there between the doctors. I couldn't resist it. But just about a week ago, I was on a similar program, this time on radio, and we also had a guest who, at 30 years old, had begun smoking at the age of 15. Wow. By 25, he had high blood pressure. He's 30 now, and his readings were crazy. High blood pressure. He started having high blood pressure from the time of 20 years old. Why? Because of the smoking. And all of this, I think, he typifies, is an example of many other young people in the country. I remember when I was much younger, BP, diabetes, those were old people.
Unheard of before.
But now
with young people that are actually, and just to add on as well, I think when you talk about the impact just on the financial aspect as well, the impact is quite huge. Because I think Dr. Naledi has talked about an addiction. So what happens when someone is addicted is that they will do anything possible to actually get that particular product. So I believe that there are people that are addicted to tobacco, and they even go lengths as far as borrowing, they're in debt, just to be able to finance the cravings of being able to buy a cigarette or being able to buy shisha. So we see that some of these effects are far-reaching, and they're very, very big impacts that we need to think about as people, even as we are actually engaging in these activities, because at the end of the day, the cost implications really are huge, especially on the individual and even on a country as well. And health is something that we can't trade for anything. The moment that your health starts failing, then the ball game changes, because everything then starts rising. You need transport to go to the facility, you need transport, you need money to buy drugs. If you're infertile, you need money to start thinking about a fertility clinic, IVF, and all these things are quite costly. So we see that really the cost implication is so huge. So this is a call-in interview. The number you're calling us definitely is the one that's displayed on your screen. So we'll definitely be able to address your contribution. So Dr. Naledi here and Mr. Piri have given a very good synopsis of the topic of discussion today. And if you've got any questions, now is the chance to be able to ask these questions. So we'll go on a very short break. When we come back, we'll continue to break down just the harmful effects of tobacco and also look at what we can do then as a country and as individuals to help ourselves out of this particular crisis. So we'll be right back after this short break. Please do stay tuned.
Did you know that 46% of the deaths that we record in Zambia are as a result of inadequate access to healthcare services? Seeing that was a gap, Tele Doctor was birthed because it was working in line with what the Ministry of Health wants, which is providing effective and quality healthcare as close to the family as possible. We want to bridge the gap by telling you to get your smartphone and just download the app. Once you download the app, you can actually book for an appointment with a doctor or any licensed medical personnel. Do you also need a refill with your prescription? Quite all right, we do that and deliver the drugs from the comfort of your own home at your doorstep. So you can download the app or visit our website for more information.
Ambuya, are you okay? Thankfully, with the Tele Doctor app, you can get premium healthcare from the comfort of your home. With the Tele Doctor app, all it takes is a click, and you could not only have a nurse or doctor come and see you, you can also receive specialized services such as nursing and physiotherapy.
You see, Teledoctor aims to make access to healthcare services cheaper, faster, and convenient.
Patient app registration. After downloading the Teledoctor application, to sign in, click on the Sign In button. This will lead you to a page where you can create your own account. Fill in your phone number and email address with a valid email address. Create a new password, being careful to add an uppercase letter, a lowercase letter, a special character, a number, and a minimum of 8 characters. Fill in your names, sex, date of birth, and click to agree to the terms and privacy policy. Then, click the sign up button, which will redirect you to the login page. Fill in your email address and await a one-time password in your email inbox. To complete the 2-factor authentication, copy and paste the number emailed to you and press the login button. Then, welcome aboard! You would now have effectively signed in and are now ready to use the Teledoctor application.
All right, so welcome back to Tele Doctor Show this wonderful afternoon. If you just joined us, I'm Dr. Blessings, and I've been joined by Dr. Naledi and Mr. Piri, and we're discussing tobacco and just how harmful it actually is on our health, on the environment, and on the economy. And the two guests have really spoken at length about just how harmful it actually is and how all of us needs to look at how best we can stop smoking and stay away from actually smoking. So Mr. Piri did talk about the tobacco control bill roughly, and did talk about the fact that we need to regulate smoking and tobacco use here in Zambia and globally as well, because we've got so many young children being able to access these particular products, and we've also got other people that are abusing these products for various reasons. We've got women, for example, who are using nsungo for sexual pleasure and of course different reasons to keep themselves warm. So people are using a lot of these products for different reasons, but ultimately these are very addictive products, and many people are actually addicted and glued and have actually failed to actually stop smoking. So Mr. Piri, even just coming to the tobacco control bill, what are some of the contents of the bill? What should the viewers and listeners really know about this particular bill, and where are we with ensuring that there's a law that actually regulates the use of tobacco in Zambia?
Right. A robust tobacco control law is based on the WHO FCTC, the World Health Organization Framework Convention for Tobacco Control. This is a treaty that Zambia signed and ratified in 2008, but for the last 17 years has not yet been domesticated. And so we are hopeful that this year, at least, it will be domesticated by legislation. And the bill, a robust bill, which is undiluted, is based on the WHO FCTC. And the FCTC, the WHO, broke it down into an acronym called MPOWER. And that is MPOWER. So it is number one, the M, to monitor tobacco use, because you'd appreciate that tobacco is a drug and it is addictive. So the M in the legislation would entail monitoring the use of tobacco. And then the P is protecting people from smoke. Because, you'd appreciate, as doctors, you've had these cases of where people get affected by secondhand smoke. Somebody can be asthmatic or maybe an expectant mother, and, they are compromised. Their health is compromised in so many ways because of secondhand smoke. So the P in the Empower is to protect the Zambian population from secondhand smoke, because 800 people die every year, according to a study that was undertaken here, due to causes directly attributable to secondhand smoke. And then we come to the O in the Empower. The O is to offer to quit. So where there is legislation in the bill, there is provision where there are deliberate measures for people that are smokers to help stop them smoking. Cessation programs where they come into the clinic, and then doctors hold them by their hand, and then eventually they stop smoking. And then the W in the Empower is to warn about the dangers of tobacco. Right now, I think most packets of cigarettes, if not all, have a health warning. Cigarette is harmful to health. But that warning has been there for so long.
It's not working. It's not working.
In the same way, that it just becomes, like part of the product. Yeah, part of the product, yes. Yeah. So what the legislation desires to do is to make it bigger and put very graphic images of lungs that are sick, compromised, a leg with gangrene, on top there, and all those C's that Dr. Naledi talked about, to put them on the packet, so that a person picking up that packet to smoke looks at that and sees that those are the consequences of what they're about to do. So the W is to warn. And then the E in the Empower is to enforce bans on tobacco advertising. Tobacco advertising and promotion. The tobacco industry is very good at marketing and selling addiction. And as the Big Tobacco Tiny Target survey showed, here in Zambia, and those studies have been done also across the world, they target mainly children. And even in line with this year's theme, unmasking the appeal, they make smoking very, very appealing to young ones. And the packaging of the nicotine and tobacco products is very, very appealing. So it is to stop the advertising of tobacco. Tobacco is a very harmful product. And you'd appreciate, perhaps also maybe personally coming from a marketing background, the way the cigarettes and the products are marketed and advertised, that should be taken away from them. You cannot advertise poison. Hey, take this poison and kill yourself. So something has to be done. So in the legislation, it is enforcing bans on tobacco advertising and promotion. And then the R, also very importantly, is to raise taxes. To raise taxes on tobacco, to make them less accessible and also less affordable, and raise taxes. And as a tobacco control advocate in Zambia, we have been calling on what our counterparts, our colleagues in Kenya and other parts of Africa have done. There is a tobacco control fund, a tobacco fund. That 2.8 billion kwacha that government is spending every year on treating tobacco-related diseases is a big hole in the economy. So why can't we have tax, especially for tobacco, for cigarettes, and then those funds are ring-fenced to help treat and also prevent tobacco consumption. So that is what the bill is all about. But we have had word that the tobacco industry has been interfering and has been calling for the removal of some of these things. For example, removing the tax and compromising on the advertising and so on and so forth. So our hope is that the legislation, the bill, will be intact and represent this Empower acronym that will speak to a pure tobacco control legislation.
Indeed. I think that was a very well summarized way of putting the bill. So one thing that came out from the conversation or from the measures, Dr. Naledi's aspect of secondhand smoking, how harmful is it? for second-hand smokers? Because I know that at some point, all of us, at some point we became second-hand smokers. Probably you're working at a mall and just next to you, probably someone is smoking. You also get to inhale that smoke itself. So how harmful is second-hand smoking? Of course, as compared to active smoking, is it more, is it less, or are they just equally as harmful?
I would say it's more dangerous. So smoking is taken in through the mouth. And if you just by taking a deep breath, you can tell the difference of taking a breath through the nose versus through the mouth. When you are smoking secondhand smoke, it is going into your nose, which is more sensitive in terms of absorption. So all the toxins and the waste that is coming from the cigarette itself and the smoke that is blown out, you yourself are not keeping in, but you are passing on to other people. So I do think it is more toxic, and it is because entering a more sensitive area, which is your nose and your respiratory system, it is absorbed in a higher rate. So you find yourself innocently walking by and somebody is smoking, and you're not only getting the waste from the smoke from the fire that's burning, you're also getting the smoke that's being blown out as waste from somebody else. So I think I would say it's more dangerous, and a lot of the time it's not well regulated. It's something you wouldn't know you've done, but I can assure you we've all done it. And if you've ever even just inhaled burning leaves by walking by the side of the road, you know how dangerous it can be. Right? It chokes, your eyes water, things are going wrong. But because it's a cigarette, it's in a smaller quantity, and you're not really aware of the kind of damage that you are incurring whenever you are taking up that secondhand smoke.
All right, indeed. So there are viewers probably right now who genuinely want to stop smoking. So Dr. Naledi, these are people that probably they know that, okay, you know, I smoke and smoking is bad for my health, and I've been trying to quit, but I've actually not been able to. So is there any help that we're offering for those who want to quit smoking, and what are some of the interventions that are currently available for people who want to stop smoking?
So it really depends on the level at which you are. If you are in your early stages, I think it's easiest to quit at this point, but it's never too late to make an attempt. And if you have already made several attempts at quitting, I think it's fair to say you're a person who wants to quit. So talking to a healthcare provider is at least the first step in providing one new coping mechanism. Smoking has been selected for being very good at coping mechanisms for stress. And if we start to look at it as healthcare workers, to have the discussion with people to say there is help available, I think it's a beginning point of people actually being more comfortable in seeking that help. Counseling has been something that has worked really well in countries like the UK, in countries like Kenya. They have been able to sit down and ask the client saying, how many times have you quit smoking? How long do you think it will take you to quit? You want to think about it in a more of a cumulative way, because the effects of smoking are additive. The last cigarette you had is not the last cigarette you have, right? It means it continues causing effects in the future. So you want to sit down and have a discussion around what are the best ways. We have nicotine replacement therapy, which I think here in Zambia can be a bit costly. So I would recommend that for a person who is not able to afford it, would sit down and just maybe start the process of quitting. We have what we call a 7-day quit guide here in Zambia. It's just an imaginary goal as to how you would do in the next 7 days. If you want to smoke, let's say if you smoke 8 cigarettes a day, let's make it 7 in the next 7 days. Let's make it 5 in the next 7 days. Depending on your will, firstly, I think that is something that's very important. And just also being able to receive that support. There are areas where you can have these conversations with a healthcare worker. We do a lot of health talks to educate, and we are trying to remove the stigma. In being honest, a lot of people who come to us and not admit they're using Sunko for things like sexual pleasure, because aside from it being embarrassing, it's a taboo thing to talk about, but it's something that will affect your health in ways that we can't explain if we don't know the cause. So being able to remove that stigma, and I think Mr. Piri has also spoken about removing the glamour associated with tobacco use, being able to show people the outcomes, how sick people are, how sick people get when they use it, I think also is a motivator to quit. But a lot of the time here in Zambia, we do rely a lot on counseling and your willpower. We do offer services in our facilities, though not as robust as in high-income countries. We are making efforts to improve that, and we are able to start to inform policy around making sure that tobacco use cessation is something we are more engaged in as healthcare workers, and we are also involving the community more in, just to ensure if you are worried about somebody smoking regularly, and if you want to start your journey towards being tobacco free, you can start without any roadblocks. So I think that would be something to look at here in Zambia more.
All right, interesting, well explained. So I just have a few myths and facts as we are heading towards the close of our conversation today. So I'll ask Mr. Piri one. You say whether it's true or false, and you explain why your answer is that way. Then, of course, I'll come to you, Dr. Naledi. So the first myth is light or social smoking isn't harmful. Is this true or false, Mr. Piri? Social smoking, I'm just having fun.
yeah. That is like saying, I think, that camels are found in the Arctic, or penguins are found in the Sahara. That is absolutely not true. Yeah. There is no safe level of smoking at all. And in fact, it is said, the WHO says that cigarette smoking, cigarette is the only thing that kills half of its users that use it correctly. Yeah, so there is no safe level of smoking at all.
All right, Dr. Naledi, the second one, smokeless tobacco like snuff is safe. Is this true or false?
It's false. There is no safe form of tobacco use. Things like snuff especially are associated with things like oral cancers and respiratory diseases. We tend to introduce it to an area that is very clean a lot of the time, our sinuses, and when you take that up, we erode the lining of our mucosa, which is the area inside the nose, and you start to cause a lot of damage. So I think there is no safe form of tobacco use that I've come across. But if somebody would like to prove me wrong, I'm happy to have that debate.
Happy to have the debate. All right. Mr. Piri, quitting after years of smoking won't make a difference. Is this true or is false?
Oh, that's false. It does make a difference. It does make a difference. For reasons I think that Dr. Naledi and yourself, Dr. Blessing, as medical doctors, it does make a difference.
All right. And Dr. Naledi, tobacco is only a personal choice. It doesn't affect others. Is this true or false?
That is false.
Yeah.
Like we've mentioned a lot about secondhand smoking. It does not just affect you. It affects people who don't consent to smoking. And a lot of the time, you become a societal burden when you fall ill from things like tobacco-related illnesses. So if you're sick in the hospital and you're spending 6 months in CDH because you have lung cancer from smoking or oral cancer from snuff, you are costing taxpayers money, right? You are not just costing taxpayers money, you're also stressing your family. So I think the expense is immeasurable. We can't really quantify the kinds of stress your children are going through visiting you in hospital. So it is a personal choice, yes, but it is something
that affects others.
It is a poor choice we should discourage.
Right. As we draw to a close of this wonderful conversation, Dr. Naledi, I want you to look in the camera over there and in 30 seconds, your last message to our viewers.
Please quit smoking.
That was short. And Mr. Piri can do the same. Just look in front of the camera and just in 30 seconds, your last message to our wonderful viewers.
Zambia is being turned into an ashtray.
Yeah.
And my appeal is to... Which one is the camera, first of all? Where am I looking?
That one.
That one over there, right. So my appeal is to government. It is very, very necessary, it is imperative to pass the tobacco control bill in its pure form. Keep the taxes in there, raising the taxes. The U.S. government has pulled the plug in terms of supporting the health sector, and we need to tax the tobacco industry equitably so that they pay fair share of taxes, so that the country can eventually take care of the healthcare costs attributable to tobacco.
All right, thank you so much, both. So we're drawing to a conclusion of this wonderful conversation. But before we close, allow me to just remind you of the wonderful clinics that are available on the Tele Doctor application, of course, in conjunction with Woodland Specialist Clinic. So you'll be able to see those clinics row on your screen. But as I said, we've got a variety of clinics, and the number that you can actually dial or reach out to us on is 0979 904046, 0979 904046, and you'll definitely be able to speak speak to a specialist, you'll definitely be able to speak to someone on the Teledoctor Show, and we'll be able to book you in a variety of clinics. So we have things like hypertension and diabetes clinic. So for those who may have hypertension or high blood pressure, those who may have high blood sugar or diabetes, there's a clinic for you. For the men or the couples as well that may be infertile, that may be wanting to conceive, we also have a clinic for you. For those who may be having joint pains or bone pains, we also have an orthopedics clinic for you, where you can be able to speak to a specialist and you can be assisted in those variety of ways. And we also have the variety of services as well with women as well. We're also working to see how best we can also take care of women during their pregnancy, and we do have specialists that are actually just tasked to be able to help you in this particular regard. And of course, if you want to ask any other question related to your health, we do have a Teledoctor application where you can be able to, which you can be able to download, and you'll be able to speak to a specialist on that particular platform. So today we have been discussing tobacco, and even as we head towards World No Tobacco Day, we're urging all of you, our viewers, who may be smoking or who may know someone who may be smoking, to please encourage them to stop smoking, because there's no safe level of smoking. Dr. Naledi did talk about the 3 C's: cancer, cardiovascular diseases. We've got so many young people right now having high blood pressure, hypertension, not because of anything else, but because they're engaged in these activities of smoking and using different types of tobacco products, shisha as well. So we've got a variety of newer products available on the market that may seem cooler and may seem more fun, but these are equally, if not even more than harmful. Actually, they say one session of shisha is equals to 100 cigarettes, right? So it means when you do 1 hour of shisha, you smoke like 100 cigarettes. So it's just more harmful actually. So we're urging all of you to actually stop. So again, we are back tomorrow on Radio Phoenix at 9 hours, and we'll be of course discussing a different topic. You can join us, and we'll definitely be glad to have you. So this has been yours truly, Dr. Blessings. I was joined by Dr. Naledi and Mr. Piri. It's been a pleasure having you both on today's show. We're extremely grateful that you could join us. And to you everyone, have a restful evening and enjoy the rest of the week. Bye bye, and see you next week.